I'm Mary Hale. I'm a certified personal trainer and exercise physiologist at UNC Wellness Center at Meadowmont. We are here today to show you some common practices, common exercises to help alleviate some pain and joint stiffness with osteoarthritis. The main thing is everything's about physics. It's just about angles. So you can either do knee bends here, holding onto the back of a chair. Think about hovering over a chair as if there's something behind you. Butt goes back, knees stay behind the toes. So all your weight at the bottom should be in the heels. Now, not everybody can do that kind of a squat. So that's where I always bring the chair in and have people basically just sit, stand. If they need to push off of something, the goal, of course, would be not to push off of something. But if you need to, you got the perfect anatomical structure right here, pushing off your legs. That's independence. And again, you're leading with your backside. Arms can be out front. If that works really well and it's too easy, one thing that we have people do is hold their arms up overhead. Now, if you have shoulder arthritis, that may not happen. But even just so the next thing for squats, that's hips and knees together. This one's more for low spine and then the hip. So holding on to something, really good posture, think very military. And you're gonna take leg behind you. And just kick it back. Your glute is gonna catch it. It's not gonna let you go very far. It's not a huge movement, maybe 20, 25 degrees. But it's getting glute maximus, medius, and minimus are up here, which is really just hip stabilizers, and then low spine. So, and if you feel good about it, being able to lift up in the front and that full range of motion. If you're able to do it without holding on to something, the balance piece is really good, especially for older populations. Most people have got some sort of like ankle weight at home. If you don't, stick in a couple rolls of coins or a can of soda or something in a sock and tying it around your leg works perfect. You don't need a lot. Just sitting and taking your leg up in the front. And not everybody can get terminal leg extension or that perfect, 180 degrees. But since the goal is to activate the quad, you don't have to go up all the way. Even just some extension activates them. Let pain be your guide. If anything hurts, and let me define pain as, if you're doing a movement and the discomfort, is still present when you stop, that's pain. Discomfort's okay. Pain is no good. Find a wall. We're gonna lean up against it and make sure your shoulder blades make contact with the wall. And the goal here is gonna be to keep your shoulders in contact with the wall at all times. Feet are gonna be a little bit ahead so that your spine stays nice and neutral. You're gonna start in the front, head up against the wall, reach up. This plane of motion for shoulders is really safe. So usually with arthritis at the shoulders, now, as long as it's not frozen shoulder, but taking up, the goal being to be able to touch the wall overhead and keep your head in contact with the wall. If you can't do that, the big muscles in your back or your lats are generally too tight. If the shoulders allow it, with this kind of band opening up in the front. And really encouraging the chest to open up and the shoulders to open up. But that, again, pain's gotta be your guide. So if that bothers you here, this one is definitely the most, that's the safest one. If you develop any pain or any pain that you already had persists or anything develops during your exercise, please don't hesitate to contact your primary care physician or an orthopedic specialist. Thank you so much for joining us today and watching this video. If there's anything that we can do for you with regards to exercise questions or a program that you can use to fit your needs as far as arthritis is concerned, please don't hesitate to contact the personal training department at either UNC Wellness Center at Meadowmont in Chapel Hill or Northwest Cary.